Even when the pandemic ends, the impact on our hospitals and healthcare workers won't be over.
That was the message when we brought staff together from Cincinnati's major hospital networks. WLWT investigative reporter Jatera McGee is here in the studio now with that impactful conversation you'll see only here on WLWT.
Definitely powerful. I sat down with Dr. Thomas Lamar, Dr. Suzanne Bennett, Dr. Daniel Murphy, and RN Bill Hawk. They work with the sickest COVID-19 patients, and even they've struggled to explain the seriousness of the situation to their own loved ones and friends.
I know family members of mine who had any question about getting the vaccine in the past. Where they made that pivotal decision to get the vaccine was no words that I could say. No words I said made a difference. It was they lost a friend close to them to COVID who was otherwise healthy, a picture of health the week before.
It's just a daily fight every single day with the lack of trust and the fear. And you know, you get tired. We've been doing this a long time. People continue to, question and challenge, and if it were pneumonia or cancer or stroke, they would listen to you and would gladly accept your advice and your service. But when it comes to this, in all facets, it's just remarkable. They don't believe a thing you say. I mean, it's just nothing I've ever seen before.
Do you fear that continues when the pandemic is over?
I think we live in an age of disinformation and belief-based reality, and I think things will never be the same, at least for a period of time.
The misinformation is insurmountable, and I feel bad that the public is being given all this information. They don't know where to go. I think they're victims just as much as someone in a motor vehicle accident, and they're victims.
Healthcare workers have been getting by and making do for a year and a half. Many are reaching their breaking point.
We're seeing a lot more nurses leave the profession, either to go travel, just retire, or just get out of nursing altogether. They're burnt out, they're fed up, and so it's hard right now.
I think we all know and recognize that this current situation isn't sustainable for all of you or for the hospital system. Is there that constant fear of, okay, well, what happens after Thanksgiving this year? What does January look like?
For me, it's one day at a time.
Yeah, absolutely.
One weekend at a time, 1 week at a time. People ask me about, December or January, so let's just worry about getting through this week.
Right.
I agree with him. It's just trying to get through every day, but I do, part of my job, I'm also regional director for the Cincinnati area, so I have to look at some of our staffing issues, and seeing a lot of nurses who are leaving, respiratory therapists that are leaving. There's just not enough people to go around. It does worry me where the healthcare systems are going, not just mine, but all of them.
Absolutely.
There are a lot of things in healthcare that are broken, that are challenging, not just with COVID. They were broken before.
We will learn from what COVID unveiled, the cracks from the pressure that COVID unveiled, and be better. I think we will be better.
COVID's going to end, but there's a lot of stuff that has to be reckoned with when this is all over.
This group expressed a lot of concern about when the pandemic ends. We'll have more from this exclusive conversation tonight at 11, focusing on some of their personal stories, what's giving them strength, and why they still have hope. Jatera McGee, WLWT News 5.